what's the matter?
Doctors, that's what's the matter. Listen to this. A few hours ago, I'm on duty in the ER. They wheel in this man in his middle 40s, and his wife tells us he's just had a big, heavy meal. He's complaining of epigastric pain and nausea. Dr. Reynolds was the only one on duty, but he was busy with another patient who was having a GI bleed and was pretty shocky. Since I've spent a year in the coronary care unit, as well as 2 years in the ER, I'd seen plenty of similar cases. So I paged the medical resident on duty, then I got an EKG, and once I'd looked at it, I was pretty sure he was having an MI. He also had occasional PVCs, so I started an IV line with dextrose and water and prepared a lidocaine drip, ready to be plugged in if Dr. Reynolds agreed. Also, I got the crash cart. It was about 4 minutes or so before he could look at the patient, but he's new to the ER, and instead of getting right to it, he starts giving me a hard time about diagnosing the patient, saying that doctors diagnose, nurses don't. Meanwhile, the patient needed attention.
So now, I come to this patient, a man in his mid-40s, and naturally, I begin taking a history. But before I can get started, one of the nurses on duty, Sue Thompson, starts telling me that she's already taken a history and an EKG, and she's got a lidocaine drip ready because she's convinced the man's having an MI. Can you imagine?
What did you do?
I calmly said to her, "Thank you very much for your help, but I'll make my assessment."
This program is about the expanding role of nurses and the legal implications of that role expansion. In the fictional segments you've just seen, the doctor and nurse disagreed about the scope of the nurse's role and responsibilities. As the role of nurses continues to undergo unprecedented change and expansion, similar incidents of conflict and tension between doctors and nurses are more likely to occur. This kind of conflict can be a real source of trouble for a hospital and its patients. Who, if anyone, behaved improperly in the incident between Dr. Reynolds and Nurse Thompson? To understand that, we must understand the role of the professional nurse and the permissible scope of nursing practice, which may differ from state to state. Many states have authorized an expanded role for nurses beyond the traditional role that consisted largely of carrying out a doctor's orders. One aspect of this expanded role is specific authority to formulate a nursing diagnosis, which, if it exists, can be found in the state's Nursing Practice Act. Such a diagnosis must be limited to the interpretation of clinical signs, symptoms, and accompanying data in arriving at a judgment about whether a patient requires care which can be instituted on a nurse's initiative or medical treatment, which must be rendered by a physician. This type of change, which includes the authority to diagnose, actually redefines what nursing is all about. Nursing diagnosis is not the same as medical diagnosis. In a state where nursing diagnosis is permitted, a nurse has not only the authority, but also the legal responsibility to recognize and evaluate signs and symptoms of a condition that could require either medical attention or nursing intervention. The fundamental difference is that a nurse who makes a nursing diagnosis would not alter the patient's medical regimen on her own. The nurse might take appropriate nursing action, such as placing a patient who is short of breath in a semi-Fowler's position. She might begin certain diagnostic procedures to save time, and she might be able to give the patient oxygen. However, she must recognize that a doctor must also be called to make a medical diagnosis and provide appropriate treatment. Besides actually redefining nursing practice, many state nursing boards are changing their regulations to specifically permit nurses to perform clinical procedures which have not traditionally been within the technical province of the professional nurse. For example, state regulations might be changed to permit nurses to start IVs, perform certain diagnostic procedures, or do arterial punctures. Nurse Thompson, you will remember, started an IV and performed an EKG. Both actions were specifically permitted by her state's nursing regulations and her hospital's emergency room nursing policies. Nurse Thompson practices in a state that has expanded both aspects of the nurse's role to include nursing diagnosis and expanded clinical practice. With this in mind, let's take a closer look at what happened. Nurse Thompson used her experience in critical care nursing to determine that an EKG was in order. That was proper. Based on the EKG, she judged that the patient was probably having an MI, so she started an IV line and mixed a lidocaine drip. That was proper too, since her state permits nurses to start IVs, and Nurse Thompson used good nursing judgment to assess the patient's needs. It would not have been proper to start the lidocaine drip, but she didn't do that. Later, when Dr. Reynolds arrived, it was necessary and appropriate for him to make a medical diagnosis. So, which one of them acted improperly? Actually, neither under the law. But if Dr. Reynolds did question Nurse Thompson for doing her job properly, that was wrong. And if Nurse Thompson did try to pressure Dr. Reynolds into beginning treatment before he had examined and evaluated the patient, that was wrong. What's important, though, is that professionals like Nurse Thompson and Dr. Reynolds must work together, taking advantage of each other's considerable skills for their benefit, for the benefit of their patients, and for the benefit of the hospital. Let's consider what the consequences might be if a nurse does not understand the scope of nursing practice and either exceeds the limits or fails to act in a manner consistent with the Nursing Practice Act in his or her state.
Well, everything seems under control. I'll be back right after I check on OR2.
Okay, Sam, I've got everything set to go.
Yeah, I'm ready to get started as soon as you get back.
Well, Mr. Crowley, we're all set. Are you?
I guess so.
Well, this will put you to sleep. Why don't you count backwards from 100? I bet you don't make 90.
100, 99, 98.
Hey, what are you doing?
I just gave him his pentothal injection.
What? You did what? You gave it without an anesthesiologist present?
Well, he'll be right back. And he was just about to tell me to do it, and he had already chosen pentothal. I was trying to save time.
It's not your job to save time, nor to give injections in Sam's absence.
Come on, I do this every day.
Not with my patients, you don't.
I'm sorry, I didn't think it was a big deal.
What's the problem? Nurse Phillips just gave the pentothal injections in your absence, Sam.
You should have waited. No harm was done. Why don't we proceed? Let's begin with the inhalation anesthesia, because I gotta get back to the other OR. I can't stay. I'll have to keep ducking in and out of here.
Well, I don't like it, Sam, and we're going to pursue this later.
Although the patient was not injured in this case, the nurse performed actions which exceeded the legal scope of her practice. State board regulations required that registered nurses who were properly trained anesthetists could administer anesthesia only under the direction and in the presence of a licensed physician or dentist. Although many states are expanding the number and type of clinical procedures which nurses may perform independently, such procedures remain strictly and specifically limited. Overstepping these limits can pose serious threats to patients, hospitals, and the offending nurse. Possible consequences to the nurse include disciplinary action by the State Board of Nursing, civil liability, or criminal prosecution. There are 3 disciplinary actions possible from the State Board of Nursing: a reprimand, a license suspension, and/or a license revocation. In addition to disciplinary action, a nurse who has either overstepped his or her authority or who has failed to fulfill his or her nursing responsibilities may face a civil suit if a patient has been harmed in the process. The standard of nursing care may vary from state to state for each area of nursing. For example, in some states, the standard of care required in a given situation may differ for an ICU nurse, an emergency room nurse, and an occupational health nurse. This may mean, for example, that an ICU nurse is required to be more highly skilled than a clinical nurse. Finally, in extreme cases, a nurse may face criminal charges if he or she exceeds the scope of nursing practice in an illegal fashion, such as procuring a license through fraud, illegally obtaining drugs, or improperly terminating treatment or life support systems. In the case of the nurse who administered anesthesia independently, the surgical resident filed a complaint against the nurse, and the state board found the nurse's action to be a willful violation of the regulations. A formal reprimand was issued, but the board could have suspended or even revoked the nurse's license if it had chosen, under the terms of the state's Nursing Practice Act. Further, by overstepping the scope of her practice, the nurse and possibly the hospital would have been vulnerable to liability for malpractice if the patient had been harmed by the anesthesia. In order to provide the proper standard of care and avoid potential penalties, nurses must know both the limits and requirements of the scope of nursing practice in their states. In the case that follows, it is not a clinical procedure, but the nurse's diagnosis that leads to problems.
It doesn't actually hurt, but it doesn't seem to go away.
Well, it does seem to be healing rather slowly. Let's see, how long ago did this happen? A month ago?
No, it was more than that. Oh, I remember. I got jabbed in the head, let's see, it's almost 3 months now. It was just a little puncture wound, but why hasn't it healed up yet?
I don't know. It should be fine. It's just a small cut, and I cleaned and bandaged it. It should be fine in a few days.
That's what you said last time, and it hasn't healed yet.
Well, have you been fussing with it, touching the scab and playing with it a lot?
No, of course not. I haven't been messing with
Let
it.
alone let it heal.
Look, I've been here 4 or 5 times. I don't know what else to do. Isn't there a cream or some kind of medication I can use? Are you sure I shouldn't see a doctor? I mean, I don't want to make a big deal of this, but...
Well, I've told you several times, I really don't see the need for you to go to a physician on this. It's just a small cut. But look, if you feel that uneasy, here, you go see Dr. Johnson, and you can set your mind at ease, all right?
Dr. Johnson?
Yeah.
The patient in the actual case, which you've just seen dramatized, had to go through 2 successive operations to remove fairly extensive basal cell carcinoma from his forehead. He was left with a large and permanent scar. The patient sued the nurse for negligence and was awarded substantial financial damages. The patient had quite rightly relied on the professional judgment and diagnosis of the nurse, who had advised him that medical attention was unnecessary. The nurse was liable to the patient because, in failing to recognize that the problem required the attention of a physician, she failed to make an accurate nursing diagnosis. The nurse had not only the authority, but also the legal responsibility to advise her patient that medical treatment beyond the scope of her nursing practice was required. The actual cases you've seen emphasize various aspects of the expanding role of nurses and the consequences of not understanding or fulfilling that expanded role. But the cases also point out that it is the responsibility of each individual nurse to understand exactly what the scope and limitations of nursing practice are under his or her state's Nursing Practice Act, state nursing board regulations, and any other legal restrictions which may apply in addition to hospital policies. You, as a nurse, have the responsibility of acting properly, efficiently, and competently within the limits of your nursing license. Remember, even if a given hospital policy clearly exceeds the limits imposed by the law, or if someone in authority tells you to do something impermissible under the law, you must obey the law. The only way to protect yourself and to meet your professional responsibilities is to be informed. Know the law as it applies to you. You can find out about your state law from the State Nursing Board or the State Nurses Association. By being aware of the scope of your role as a nurse, you can improve the delivery of health care at your institution.